Alaikum and welcome to the Informative Globe by Hafiz Sanaullah Zakir YouTube channel. Please subscribe my YouTube channel and watch the video till end. Today's topic is about antipsychotic drugs. What are antipsychotic drugs, their classification and mode of action will discuss here. So let's start. Antipsychotic drugs. First of all, what is the meaning of antipsychotic? Anti mean against and psychotic mean psychosis, mean those drugs which are used to reduce the psychotic actions. Psychotic mean in Urdu ज़हनी इंतशार या नफ्सियाती. So those drugs which are used to reduce the psychotic actions are known as antipsychotic drugs. So first of all, little bit I will tell about the antipsychotics. The term psychosis denotes a variety of mental disorders, mean the presence of delusions, mean false beliefs and hallucinations, usually auditory or visual, but sometimes tactile or olfactory, and grossly disorganized thinking in a clear sensorium. Here there are two terms. Number one, delusions, and number two, hallucination. Delusion mean in Urdu waswasa या धोखा, and hallucination mean खफकान या वहम और फ्रेब तस्वुर, मीन वसवसे और जो फ्रेब तस्वुरात पैदा होते हैं जहन में, इसको साइकोसिस कहते हैं. One of the example of psychosis is schizophrenia. Schizophrenia is a particular kind of psychosis characterized by a clear sensorium but a marked thinking disturbance. Schizophrenia is a serious mental disorder in which people interpret reality abnormally. Schizophrenia may result in some combination of hallucinations and delusions and extremely disordered thinking and behavior that impairs daily functioning. Schizophrenia is not unique to psychosis is not unique with schizophrenia and is not present in all patients with schizophrenia at all times. Antipsychotics are used primarily to treat schizophrenia and also effective in other psychotic and manic states. And antipsychotic drugs are not curative and don't eliminate chronic thought disorders. Chronic thought disorders. But they often decrease the intensity of hallucinations and delusions. To permit a person with schizophrenia to function in a supportive environment. अभी हम क्लासिफिकेशन की तरफ आएंगे. क्लासिफिकेशन ऑफ antipsychotic drugs. Antipsychotic drugs are usually divided into two categories. Number one, first generation antipsychotics, and number two, second generation antipsychotics. The first generation antipsychotics are further classified into two categories. Number one, low potency, and number two, high potency. Now I will tell little bit about the drugs, which drugs are present in which class. In low potency, CT, it is my own formula by which you can remember these drugs easily. From C, chlorpromazine. From T, thioridazine. And in high potency, the drugs present are pharmacology. This is the formula of drugs by which you can remember high potency drugs easily. From F, fluoxetine. Fluphenazine. From H, haloperidol. From L, loxapine. From M, molindone. From first P, phenazine. From second P, pimozide. From third P, chlorpyrazine. And from T, thiothixine. And from the T, trifluopyrazine. अभी सेकेंड जनरेशन एंटीसाइकोटिक्स की तरफ आएंगे. ये फार्मूला इज एब सीलो फकरिज. ये जो इतना बड़ा फार्मूला है ये इसलिए हैं ताकि बआसानी आप लोग ड्रग्स को याद कर सकें. फ्राम ए एरीफिप्राजोल. फ्राम सेकंड ए एसिनापिन. फ्राम बी ब्रेक्स पिप्राजोल. फ्राम सी cariprazine. From second C, clozapine. From I, iloperidone. From O, olanzapine. From P, paliperidone. From second P, pimavanserin. From Q, quetiapine. From R, risperidone. ziprasidone. And L यहाँ लिखेंगे लोराजिडोन. तो ये फर्स्ट जनरेशन एंड सेकंड जनरेशन के जितने भी ड्रग्स थे उनकी क्लासिफिकेशन थी. अभी फर्स्ट जनरेशन के कुछ जो प्रॉपर्टीज़ हैं वो मैं आप लोगों को बताऊंगा और सेकंड जनरेशन की जो कुछ प्रॉपर्टीज़ हैं वो मैं आपको बताऊंगा कि उनकी इफ़ेक्ट्स क्या हैं. फर्स्ट जनरेशन के इफ़ेक्ट्स क्या है और सेकंड जनरेशन के इफ़ेक्ट्स क्या हैं. फर्स्ट जनरेशन antipsychotics are also called conventional and are competitive inhibitors at a variety of receptors, but their antipsychotic effects reflects competitive blockade of dopamine D2 receptors. And next point here is first generation antipsychotics are more likely to be associated with moment disorders known as extrapyramidal symptoms. शॉर्ट फॉर्म उसका क्या है? EPS, एक्स्ट्रा पैरामाइडल सिम्टम्स। तो ये कुछ प्रॉपर्टीज़ हैं फर्स्ट जनरेशन की। अभी सेकंड जनरेशन एंटीसाइकोटिक्स के बारे में पढ़ेंगे। सेकंड जनरेशन एंटीसाइकोटिक्स are also called atypical antipsychotics. Have a lower incidence of extrapyramidal symptoms than the first generation agents. Second generation antipsychotic drugs may cause some metabolic adverse effects such as diabetes, hypercholesterolemia, and weight gain. While second generation antipsychotic drugs are generally used as first line therapy for schizophrenia to minimize the risk of debilitating